third hour with Met in Focus. Right now, we're back once again in Met Focus. Today, we're going to be focusing on migraines under the topic of terminating migraines and how to cure the symptoms with Dr. Kiratikorn Vongvaivanich, Neuroscience Center at Bangkok Hospital. So for those of you who are watching right now, share our Facebook Live, leave comments because Bangkok Hospital has a free e-vouchers for quadrivalent influenza vaccine, 2 prizes to be given away ดังนั้นแล้วนะคะเดี๋ยววันนี้เราจะมาพูดคุยนะคะกับนายแพทย์กีรติกรว่องไววานิชนะคะ Neuroscience Center จากโรงพยาบาลกรุงเทพนะคะถึงเรื่องราวของไมเกรนนั่นเองค่ะ สวัสดีค่ะ
สวัสดีครับสวัสดีครับ
สวัสดีค่ะ Hello Dr. กีรติกรว่องไววานิช Neuroscience Center at Bangkok Hospital. How are you?
I'm good, thank you. How are you today?
I'm really, really good. I'm really excited to talk today because it is I would say a very common topic that occurs a lot to everybody about migraines.
Yes, because my migraine has prevalence in both sex and all age. So we have a lot of patients with migraine in the population for at least 15%.
Right. So I've been reading before this and information about from Bangkok Hospital. It says that women has higher risk in having migraine more than men. Is that true?
Yes, that's true. So that's why the first thing, if you can see.
Oh, คุณหมอ is frozen. I think there's some technical internet connection problems, but we would like to know more about migraines. And I mean, me personally would like to know why females have higher risk than male เดี๋ยววันนี้นะคะก็จะมาคุณหมอจะมาไขข้อสงสัยนะคะเมสเตอร์ว่าทำไมผู้หญิงถึงเกิดอาการไมเกรนมากกว่าผู้ชายแล้วก็คนกลุ่มไหนบ้างอายุเท่าไหนบ้างนะคะ Okay, I think the doctor is back คุณหมอคะ
ครับ Do you hear me?
All right, I hear you now perfectly fine.
All right, okay.
All right.
I'm back. All right, okay. If you see my slide about the prevalence of migraine, okay.
Right.
On the first that you see a boy and girl, you can see the prevalence of migraine is pretty same. However, after girl has first menstruation,
right.
you can see the blue light is going up a lot. It's different because it's a hormone
right.
in women.
Okay, and then it peaks at it peaks when women are 30.
Sorry?
Hello? Can you hear me?
Not so well.
Oh,
okay.
Please. Can you hear me, doctor?
Yes.
Oh, okay. All right, let's continue.
Yeah. Okay. And please, next slide, please.
The next slide. Okay, so as we can see, women has a very high risk in getting migraines, way more than men.
All right. Okay. This one show the hormone during menstruation. So you can see the black line. Okay, it's a hormone fluctuation.
Mm-hmm.
Before menstruation, you can see the estrogen level drop a lot.
Right.
And the shade one, the gray shade is going up. It means the migraine attack easier during that time. Okay, it's make a woman more susceptible for the migraine attack than men.
Right.
This one is the main reason.
Okay, so this is the period cycle too, right? At the bottom it says day of cycle.
Yes. It's about the cycle. It's a hormone change and in.
Uh-oh. I think the signal is not so stable. Doctor, can you hear me?
Do you hear me?
Okay, I hear you now. So
All right.
the day of the cycle is so you're saying from this graph is saying that the first day that women have period are most likely to have migraines.
Exactly.
Is that why we're cranky when we have period? Uh-oh. I think there are some technical problems with the internet connections. นี่นะคะเมดสเตอร์เดี๋ยวรอคุณหมอสักครู่หนึ่งนะคะสัญญาณค่อนข้างอาจจะยังไม่ stable ในวันนี้นะคะดังนั้นแล้ววันนี้เนี่ยใครมีคำถามอะไรนะคะที่อยากจะถามคุณหมอนะคะเกี่ยวกับเรื่องของไมเกรนนะคะว่าทำไมผู้หญิงเนี่ยอย่างที่คุณหมอขึ้นรูปมานะคะมันมีเรื่องการเปลี่ยนแปลงของฮอร์โมนต่างๆยิ่งเวลาเรามีประจำเดือนเนี่ยกราฟเมื่อกี้ที่โชว์ขึ้นมาเลยนะคะหนุ่มๆฟังไว้นะคะสาวๆเนี่ยนอกจากว่าอาจจะวีดแล้วจะเกิดไมเกรนในวันแรกที่ประจำเดือนมานั่นเองค่ะดังนั้นแล้วนะถ้าสมมตินะคะพอเริ่มโชว์ไซน์แล้วว่ากำลังจะมีประจำเดือนนะคะให้ รีบเคเตอร์ให้สาวๆเลยเพราะว่ามูดสวิงแน่นอนฮอร์โมนเปลี่ยนแน่นอนแถมไมเกรนมาด้วยนะคะดังนั้นแล้วเนี่ยเราจะสังเกตได้เลยสาวๆอาจจะแบบทำไมฉันไมเกรนมาบ่อยจังเลยในช่วงที่แบบมีประจำเดือนนะคะเพราะว่ามันเป็นเรื่องของร่างกายแล้วก็ฮอร์โมนของเรานั่นเองนะคะคุณหมอมาหรือยังเอ่ยตอนนี้คุณหมอมาหรือยังคะหรือว่าเราจะให้คุณหมอมาแล้วใช่ไหมคะคุณหมอมาแล้วนะคะเดี๋ยวต่อกันนะคะคุณหมอคะ hello hello can you hear me hello okay I think there are the technical problems we're gonna turn on some music while we wait for the doctor to get signal stable and then we'll be right back is he here oh okay he's here all right perfect.
Hello.
All right. Okay, we're back.
Did you hear me? Okay.
All right. Okay, so just now I was just telling our listeners that the reason that we get cranky is because of our hormones are changing when we get period, and especially on the first day when we get period, we might also get migraines from this chart.
Yes. Mm-hmm.
Right. So how do we cope with migraines?
So for the migraine problem has a chronic disease. So it mean we cannot cure migraine, okay? But we can control them.
Right.
So most of my patient has a lot of migraine during menstruation.
Right.
Mostly somebody not need medication,
mm-hmm.
but someone need medication. Okay,
right.
But all of my patient, I recommend to do lifestyle modification, something as sleep hygiene. Okay, if migraine patient can sleep well, they have less migraine attack. Okay, because the brain is stable. Okay, the second one, they recommend to eat regular. Okay, if they skip meal, it can make the blood sugar going down and
mm-hmm.
can trigger migraine as well.
Right.
Okay. And in Thailand it's very hot. Okay, we can lose of sweat a lot, and during exercise we also lost sweat. Okay, so I recommend to drink water. Stay hydrated. Okay,
stay hydrated, not dehydrate.
My patient have stress. Okay, I recommend to do the stress management.
Right.
Some patient need to do exercise for help for the migraine
mm-hmm.
problem.
Mm-hmm.
Okay. And some supplements such as the magnesium, vitamin B2, and coenzyme Q10 can help migraine as well. Okay.
So right, these are the treatments that we can do in order not to take medications. Now let's talk about medicines. What are the difference between the traditional and the conventional medicines?
Yes. So in the past we have it's not the migraine medicine, but is a medicine that treat another disease but can control migraine. It sound different.
Yeah.
Okay. In the past, we use some kind of medication such as anti-seizure medicine and anti-hypertension medicine for treat migraine because some patients respond well with that. But medication that not specific for the disease can have side effect.
Right.
Currently, we have medication that act on migraine pathophysiology is called the CGRP. Okay, CGRP is one kind of peptide in the brain that can make the brain has some inflammation and make a pain in the brain. So the new medication is called the anti-CGRP. Is block CGRP and it can make migraine less down. The new one is also has a very effective in migraine treatment and has a less side effect.
Right. Okay, and that is the new ways.
It's a new way. Yeah, it's a new way, and it's specific for disease.
Oh, specific now, because back in the days that's new information. I never know that we actually use medicines for like anti-seizure to cure migraines before.
Yeah, because this one just come in the Thai market around 3 or 4 years.
Oh, only?
Yes, not long.
That's really interesting to know. Okay. คุณหมอคะ Doctor, we will continue our live session in our Facebook Live, but now we're going to have to say bye to our listeners on air listening right now. So thank you so much for giving our mesters new knowledge today. And for those of you who are listening right now and would like to get to know on how to terminate migraines, stay tuned for our Facebook Live. ขอบคุณมากนะคะคุณหมอ
ครับ
ขอบคุณค่ะ All right, you guys, for those of you who are listening right now and you are having migraines, you can contact Dr. Kiratikorn Vongvaivanich Neuroscience Center at Bangkok Hospital for more information. Hello, สวัสดี สวัสดี to a healthier you. Bangkok Hospital is here. Stay fit, boost brain power, and embrace your mental health. If you are health conscious and keen on achieving excellent health, do not miss out. Sign up on our event on the 9th of September, which is this Saturday during 2 p.m. to 4 p.m. at Move and Pick BDMS Wellness Resort. Key highlights includes health talk by our expert specialists, free on-site health consultation and sports medicine, orthopedics, internal medicine, sleep and mental health, ensuring a wonderful evening ending with a cocktail. For registration, please check out on our Facebook and Instagram. More information, please contact Mr. Ralph. The number is 02-755-1696. I repeat, 02-755-1696. Stay fit, boost brain power, and embrace your mental health.
Met in focus.
Hello. Hello.
ครับ Hello.
All right, can you hear me?
Yes.
All right, perfect. Let's get to know more about Botox. Doctor, I would like to know at exactly around what age does migraine starts?
Migraine can start since childhood, okay? But the symptom might different with the adult. So mostly the childhood migraine might come with the dizziness or abdominal pain.
Oh.
But it's not a strong headache, because the child has cannot tell you very well about the headache symptom, but they can present with the nausea, vomiting, and the dizziness. It's some different with the adult.
So how can we tell if they're actually really sick or they are starting to have migraines?
Sorry?
So how can we tell that if a child is having a migraine attack?
Okay. So migraine will come with the episode of the nausea, vomiting, and headache problem. Okay. During that time, patient can have those symptoms around 2 or 3 days, and it's gone. Okay. And he has a free period for a while, and the attack it can come back again.
Oh, okay.
So it's something like the stereotypic pattern of the attack.
All right, I see. So as you were mentioning earlier, there are ways to cure. Well, we can't cure migraines, as you said. It will be there forever. Migraine. It's not going to go away. So if we don't want medication, we need to adapt our lifestyles. staying hydrated, sleep well, eat well, and what else would you suggest? Do we eat? Because you mentioned to eat well as well.
Eat well. Eat well is mean regular eating well, such as eat more fruit and vegetable. Okay. Some migraine patient has a food trigger. But some patient has take cheese, chocolate, sausages. It can trigger migraine, but it's different. It's not the same as every patient. So if the patient take this one and can trigger migraine, they should be avoid this food.
Right. And for patients who are actually taking medications, I feel like at one point, if we do take a lot of medications, we get used to the drugs. We have chronic migraines. How do we go to the next step?
Avoid chronic migraine, right?
Yeah.
Okay. So if migraine patient has more frequent migraine attack, I recommend to start medication. It's called a preventative medication for control migraine frequency less down. Okay, from the baseline. If they has more migraine attack, it can trigger the brain to more susceptible to the migraine attack, and it can turn to the chronic migraine. And the second one, if patient use lot of painkiller, it can make the brain disturb.
Okay, I think, Doctor, I think your signal is frozen again. Signal is frozen again. There are some technical problems. I can't really hear properly. Uh-oh.
Hello, do you hear me?
Okay, I hear you now. Back to the painkiller.
Oh, back to the painkiller. Okay. If migraine patient use a lot of painkiller, the painkiller can change the structure in the brain.
Right.
Okay. And the brain can susceptible to more migraine attack. It's called a medication overuse headache. So we need to limit painkiller use in the migraine patient. Okay. If they use more and more, we need to use preventative medication for them.
Right, doctor. I just recently found out something so fascinating that it's something that I've never known before. Okay. I found out from a beauty doctor that they said they can use Botox to help lessen migraine pain.
Yeah. Yes. So the Botox can work well just only in the chronic migraine patient. It means you need to have migraine more than 15 days per month. It's called a chronic migraine. Okay. We have a study in the less frequency migraine, but it doesn't work well.
Oh, okay. So that's it. So that's another case.
Yeah, yes, it's another case, but the action is not make your wrinkle less down. Okay, it's control the pain that go into your brain. Okay?
Right, that's very interesting. I never knew a Botox can actually help with that as well.
yeah, right. But this one is help for the pain is going to the nerve that send the pain signal into the brain. Okay, Botox can stop those signal and make less migraine attack.
Right. Doctor, can we go back to the period of the days that women have period? What do you suggest we do when, let's say, we have major cramps? We get cranky, we get moody, we get migraines, and everything is attacking in that day one cycle. What do you suggest we do?
Oh, it's some difficulty to suggest. So the threshold of the brain is not the same as every person. Some patient has very sensitive to hormonal change. Okay, but some is not. But if you have a very sensitive to hormonal change and make you have a migraine, you need to ask your doctor to talk about the hormone treatment or anything else that can help you.
Doctor, we have questions from our listener, from Kun Anita.
Yes,
she's
please.
asking, are headache hereditary, and is it possible for one person to have several types of headaches?
Yes, migraine is a genetic disease. Okay, so we see a lot in the family. Some patient has both dad and mom has a migraine, and patient has a risk of migraine more than 2 or 3 times.
All right, and so it's okay. So we can also get if our parents get it. And are there different types of headache or?
Actually, we have a lot of different type of the headache. But if you talk just really the migraine headache, we have the big two type of the migraine headache. The first is called the migraine without aura, and the second one is called the migraine with aura. Aura is mean transient symptom. Mostly is come with your eyes problem. Some patient has a visual disturbance, see the zigzag line or the bright dot before migraine attack. This one is has some change in the brain.
That's very interesting. Doctor, before we wrap today up, is there anything you'd like to say to our listeners who are listening and are experiencing massive migraine or having migraine problems at the moment?
Yes, if you have a migraine, please, stay healthy, do lifestyle modification. But if your migraine is worsened, please contact doctor to properly treat before it's coming to the chronic migraine.
All right. Thank you so much, Doctor, for your time today and for answering all of my questions and educating our listeners today.
Thank you.
Thank you so much. ขอบคุณ
Thank you.
ค่ะ
สวัสดีครับ
สวัสดีค่ะ and that is นายแพทย์กิรติกรว่องไววานิชนะคะ Dr. กิรติกรว่องไววานิช Neuroscience Center at Bangkok Hospital. You guys, so if you are experiencing headache or migraine, don't forget to contact Bangkok Hospital. For those of you who have missed our live during the beginning, you can also rewatch this live. Next week, what interesting topic we will be talking about, focusing with Bangkok Hospital. Stay tuned. For now, have a very nice day. Bye-bye.